And welcome to Deuk Spine Institute. I'm Dr. Deuk Majan. We're getting ready to perform a anterior cervical transdiscal Deuk laser disc repair for a patient who travels from Virginia with two herniated discs that are herniated, degenerating, and causing symptoms in his left shoulder and arm of radiculopathy. So, first thing I have to do is get into the discs using a needle, and I have to count to do that. 2, 3, 4, 5, 6. You agree we're right at 5, 6? Yeah. I think I might start at 6, 7. Shot. I'm going to come down a little bit. Go ahead and give me an AP view. Let's see where we are. The goal here is to start right over the disc that you want to start in and start in the midline. And we're not quite in the midline. I need to push over a little more. Shot. Now we're in the midline. Go back to a lateral. Fine. I'm fine. The key to this surgery is 2, 3, 4, 5, 6, 7. Everybody agree 6, 7? Yes? Shot? Yep. I'm going to move down. 2, 3, 4, 5, 6, 7. All right. Shot? It's a little lower than I want to be. Shot? 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 Let's get a quick AP. Shot. Perfect. Lateral. So I'm using my fingers to deflect the trachea and esophagus over and away from what I'm operating on. Shot. Can we move those wires, please? 2, 3, 4, 5. They shouldn't even be there. I don't know why we're not paying attention to that. Shot. Yeah. In general, we should be removing the EKG wires from the field of view. We're going to do a discogram next because we're at 6, 7. Shot. That's a little bit better, but we need to move them more. 2, 3, 4, 5, 6, 7. Everyone agree? Shot. All right, there's the dye. Look at the dye leaking out the back of the disc. That's where the problem is. That's where your annular tear is, which is the very beginning of a herniated disc. Annular tear creates or allows the creation of a herniation. Herniation then causes inflammation and sometimes pressure. Compression, we call it. So inflammation and compression. We used to believe that all these symptoms were related to compression of the nerve, but they're actually more related to inflammation. We're going to make a 4 millimeter incision in the front of his neck. The whole surgery will be done with this 4 millimeter incision. Shot. Now I'm going to be doing this surgery endoscopically. 2, 3, 4, 5, 6, 7. Is this percutaneous surgery? No, it is not. Percutaneous means done basically through a needle. There are percutaneous procedures, but this is not one of them. Shot. We have a guide wire in place. We're using the guide wire to guide the dilator down. You can see that very clearly. We're at C6, 7. Shot. You can see the dilator coming down. I use a little twisting motion so it helps move it forward. Shot. Kind of dissects through the soft tissues. Shot. And what we're doing is we're spreading apart the connective tissue that holds things together. We're not cutting anything because we're using a blunt tip. Shot. At this point, we're at the front of the spine. Can you guys see that? AP.
Yes, we can.
And the disc we're at is number 6, 7. 2, 3, 4, 5, 6, 7. That is the bottom of the two discs we're treating, 6, 7. The next one will be the one above. Shot. And we want to be in the middle, and we are. His neck is twisted a little bit. You guys see that? But yeah, we're still in the middle. All right. Just straighten him out as much as you can. He may be having muscle spasms. He has a little bit of scoliosis. All right. At this point, shot, I'm going to remove my guide wire. I'm going to advance. Yeah, I'm going to advance the dilator into the disc from the front to the back. Now, once we get to the back, we're going to bring our tube in. We're going to use this tube to do the surgery. I'm just going to go a tiny bit more. That's perfect. Next, we're going to bring this tube. It's a 4mm tube, outer diameter. The whole surgery is done through this tiny metal straw. This is called a tubular retractor. It's a retractor because it retracts the tissues away so the surgeon can do surgery, but it's also in the shape of a tube, therefore tubular. Tubular retractor. It's a type of retractor used in endoscopic surgery. You can see we've lost a drop of blood. That's it. Shot. Perfect. Shot. I'm going to advance the tube and watch it advance along the dilator. Key is we don't want the dilator tip to move in. It just moved in 1 millimeter. I want to keep an eye on that. We're just going nice and slow, 1 millimeter at a time. No rush. We're now at the back of the disc at 6, 7, and we can actually do the laser disc repair now. Okay, show us the back of the disc, show us the tip of the tube at the back of the disc. Perfect. Now take a look at this, folks. We have a 4mm incision. We've lost 2 drops of blood, and we're going to fix these 2 discs with this tiny little incision. We're using an endoscope to do that, and an endoscope lets me see what's happening inside this patient's disc. The good news is because it's a high definition, high powered endoscope, I can see very great detail. Let's show the audience, Henry, why do disc herniations cause pain and symptoms? What's the mechanism by which it happens? Okay, you can see from our video that the annular tear by itself doesn't really do anything. It's when you get a herniation in the tear that causes inflammation. Inflammation then causes symptoms like neck pain, headaches, arm pain, weakness, numbness, tingling in the arm. Those are all symptoms. You can also have myelopathic symptoms, which are symptoms of spinal cord compression. By the way, these are all pieces of herniation. They're all at the back of the disc in the tear where they should not be. Everything here that I'm touching with the laser is a herniation. Any questions?
Yes, we have a question coming from Lanu on YouTube.
Yes, Lanu.
Asking, need an advice.
Herniation right there. You guys see that? Just popped out of the foramen. That was pushing on his nerve, the nerve root. Sorry, need advice?
Need advice. People who don't have herniated discs, are there any foods that can strengthen their disc?
Oh, great. Yeah. So somebody with a normal disc, and they want to know, how do I not get a herniated disc? I would say protein and vitamins. Vitamin C, and other vitamins, multivitamins. That's what I would do. Oh, look at that herniation right there. Great question, Lanu. Any other questions?
At this moment, no current questions.
All right. Big herniation here. Left foramen, C6-7. Lots of pieces, a lot of scar tissue. Clearly been here for a while. Look at them all coming out. He travels here from Virginia with his family. Very nice family. I met his wife, his son, and I talked to his son about becoming a doctor. Sometimes this is what it takes, you know, an experience like this where your father or mother or family member has a medical procedure and kind of turns you on to medicine. Hopefully he has a good experience here with his dad. Have a little bit of calcification here, some bone spur. The laser can do that, get rid of it, it's not a problem. Remember what I've told you though, we don't get rid of every bone spur. That's not the goal of surgery. The goal of surgery is to fix the disc in such a way that it eliminates symptoms for the patient, to make the patient's quality of life better. Our goal is to get rid of pain in the neck, headaches, arm symptoms, so that the patient can actually go back to doing normal things that they want to do. That is why we do what we do, okay? Sometimes patients have really bad herniation and their spinal cord is being compromised or compressed. In that case, we have to prevent them from becoming paralyzed. That's our goal. So in some patients, it's restoration of function. In other patients, it's prevention of neurological deficit. A lot of pieces of herniation here. Any questions?
At this moment, no current questions.
We'll be fixing 2 discs. Do you want to show our audience the laser surgery?
Not a problem.
Disc injuries are a common cause of chronic back pain. The inflamed
Welcome back. All right, so we showed you our old version of the cervical Deuk laser disc repair animation, and you can see clearly that the procedure is basically done to remove herniated disc from the tear at the back of the disc and allow the disc to heal, which it's not able to do without removing that material. Discs cannot heal when they have a herniation. It's not possible. People talk about them healing, but they don't. Everyone wants you to believe they heal on their own, but they don't. They can feel better temporarily, but then the pain comes back, and unfortunately people end up living their lives in fear of recreating that pain. And there's a name for that. It's called fear avoidance behavior. I'm getting dripped on my foot. All right, you can see fibers of the posterior longitudinal ligament. That's the foramen. Scar tissue, calcium deposits, herniation, all that wonderful stuff back there, but this is a very abnormal disc. Those are fibers of the PLL, posterior longitudinal ligament.
We have another question.
Sure.
This comes from Lanu, once more on YouTube, asking, have you ever seen cancer occur in a herniated disc or lumbar disc?
No, cancer doesn't occur in a herniated disc. Never. Two totally different problems. Cancer of the spine is extremely rare. Herniated discs happen in almost everybody. Could the two of them coexist in a patient? Absolutely. But they're completely unrelated. All right. Getting back to the big herniation on the left side. That's what we're dealing with right here. This is all part of that herniation. There's another piece I had to cut off, release, and remove. Any other questions? Lots of herniation on this left side. Wow, that's a big one right there.
Yes, we have a question coming from Charlie on YouTube. Charlie asked, once a consultation has been completed, approximately how long is the wait to undergo surgery based on your current schedule? Just looking for a ballpark.
Herniation that just came out. Blue toe. Bring me a measuring thing. Guys, look at this. I just pulled this out. That was in his left foramen. Look at the size of this thing. Huge. It's like a boulder. Okay? That's just one piece, by the way. There's lots of them. And we've been picking them out one at a time. That was at C6-7. I have to say, this is one of the worst herniations I've seen in a while. Normally they're not this bad. This has a lot of material. And it looks like a more recent. Here's another big piece right here. Just for reference, the tip of that laser fiber is 0.5 millimeter, 0.5 millimeter. It gives you an idea of how big these pieces are. The inside of this tube is about 2.8 millimeters. This is all herniation. I got about 5 minutes left on this disc, Berndes, and then I'm going to move. What's the next case? It's a cervical again. You got 3 cervicals in a row. 4-level lumbar? Really? I thought it was at 3. I thought he was getting an echo at 3. Oh. All right. Yeah. Really, Eustis. Same place our patient yesterday was from. We had a Eustis, Florida yesterday. Huh. Interesting. Any questions, Henry?
At this moment, no current questions.
Huge herniation. Yeah, if we have to, put him on for next week, we can. But I don't know what Thursday looks like. Hot off the press. So, Jesus. We could do it Thursday, I guess. Definitely not Tuesday. Maybe even Wednesday. What's Patel's Wednesday schedule look like? You guys see how bad this is?
Yes, we do.
A lot of herniation here. Honestly, this is one of the worst. Huh? Well, I know. The problem is if we start moving cases because it's the end of the day, then the staff are just going to drag their heels and we'll be doing one case a day like the VA hospital does. The VA does it to save money. All right, just about done. I'm really surprised at how much herniation's here. On the MRI, it didn't look this bad. I think he's gotten worse. He may have done something more recently, but the herniations just keep coming. Let's go back and look the other direction. Again, this is C6-7. There's another piece. That one came out nice and easy. How does Wednesday look for Patel next week?
Not good.
Busy?
Yeah. Busy.
Well, wonder how he feels about waiting. I mean, we got to talk to the schedulers. So Wednesday Patel's busy with anesthesia cases?
Yes. We're down at tech next week.
Okay.
So we're not going to be able to do two X-ray cases at the same time.
Who is not going to be here? Huh? Oh, cancel Jordan's vacation.
I'm trying not to throw him under the bus because he's over there in Florida.
I'm a big believer in the truth.
Oh yeah. Just give me the truth. He's busy.
Oh my God, this is unbelievable how much herniation's here, huh? Luis? All right. Well, I said we're almost done, and I think now we finally are almost done. All this material that was here was pushing on the nerve root, sitting in the foramen here, just underneath that blue coloration. And we've removed probably 60–70% of that material so far. But you can see all the scar tissue here. This is from chronic inflammation. Years and years and years. Yeah, he 100% needed this done. No doubt about it. This is just some scar tissue. We're not here to get all of the scar tissue out. We're here to get the stuff out that we need to, that's causing his symptoms. Just want to make sure I've gotten all I can from here. I've advanced the laser fiber. That looks really good. I'm going to pull this back again just a bit. We're going to go look on the other side one more time, and then we're done with this disc. Another herniation there. Come on. Perfect.
Lights on, please. Thank you.
All right. Irrigation. One down, one to go. We've already performed his Deuk plasma rhizotomy for his facet pain. I think between the facets and the disc, he's that's going to really help him a lot, having both of those fixed. Any questions?
Yes, we have a question from Lanu once more on YouTube.
Okay.
Asking, the patient has bad herniation, a lot worse than his MRI. What happened to him?
Yeah, it's a great question. So first of all, MRI is just a picture in time, right? And certainly whatever damage is done on the MRI could get worse over time since the MRI was done. That's probably what happened. That's what mostly happens. Once somebody has a tear in their disc, the herniations come out easily. So until it gets fixed with the laser surgery we do here, you're going to keep having more and more herniations over time. So he probably just lifted things or maybe even the way he slept, you know. It could be he tossed and turned a certain way. Yeah, Dr. Berndes says that the patient told us he woke up that way. So it's very common for people to herniate their disc while they're sleeping. You know, not do the trauma, the initial trauma, but to make it worse while they're sleeping. All right, we're going to move out of the disc and to the next one, AP. I need to slide up to C5-C6. I want to make sure I'm in the middle. Shot. Straighten the neck. Yeah, we're kind of in the middle. I need to move a little bit to his left. Shot. Lateral. Looking good. Any questions?
At this moment, no current questions.
We're going to go up to the next disc using the dilator. Now we're there. I need to check the AP again. AP is front back view. You do not want to be off to the side. If you go off to the side, it's very bad. Shot, lateral, it's perfect in the middle. Perfect. And it's easy to slide to the side, by the way. I've done it before. Nope. Shot. All right, we are now inside number 5-6. We're going to do a discogram as we did before. Not easy. Shot. 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 And again. Oh, a lot of scar tissue here. I can feel it. Shot. Yep. Well, this disc is going to be fun. Shot. A lot of scar tissue, meaning an old herniation full of inflammation. But we'll get it. Go ahead. Once again, the tube goes down. Shot. We're going to advance this tube. I do need inline through the disc. Little inline traction, little retraction, 1, 2, 3. Shot. Keep the shots going, not cine, but frequent. Shot. Done. Everybody out. Perfect. 2, 3, 4, 5, 6. Yes, everyone agrees. So we finished one. We're going to start the second. Henry, let's show the audience. We talked earlier about facet joint pain in the neck, second most common cause of neck pain. Let's show the audience why do facet joints cause pain and how do we treat it at Deuk Spine Institute. It's different than anybody else. Treatment that actually works and lasts.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. You can see how facet joints cause pain. It's through the same way discs cause pain, arthritis, inflammation. Anytime you see an itis, it means inflammation. Inflammation is the cause of pain in the human body. There's really no other cause. You might have a fracture, very rare, but all other pain is due to inflammatory pain and associated with inflammation. That's why anti-inflammatories are so effective. Of course, migraines, there are exceptions to this. Migraines are one of them. Migraines aren't generally inflammatory. They're more what we call vasomotor. vasomotor instability, changes in blood flow. Come on, Nikki. Point is, most pain, if not at least 95% of it in the body, there's another herniation. It's all related to inflammation. Whether it's facet joint inflammation, disc inflammation, sacroiliac joint inflammation, piriformis muscle inflammation, they all cause pain through inflammation. Inflammation is where your body goes in and attacks an area, the inflamed area, and what happens is it causes swelling, and swelling in the area is really bad. It hurts the nerves. Nerves don't like swelling. Nerves don't like swollen tissues. Okay? So when you start getting swollen tissues, the nerves, pain nerves, start getting affected, and they start activating and sending pain signals. So a lot of pain is due to inflammation, and specifically due to swelling. Edema is the other word for it. All right. That's why when you break your arm or leg, you get swelling, and then it hurts real bad, and a few days later the pain goes away, and it goes away with the swelling. As the swelling goes away, the pain goes away. Well, in conditions like what we're treating here, pain never goes away because the swelling never stops. Because the inflammation that causes the swelling never stops. The inflammation never stops because the herniation, which is the cause of the inflammation, never goes away. So it's a cycle of herniation, inflammation, pain, and we're going to end that with this procedure here. That's what the Deuk laser disc repair does. It ends inflammation. And as such, the pain goes away and the disc can heal. Questions?
Question coming from Lanu once more on YouTube, asking, just curious, do you by any chance have Armenian heritage?
Yes. I am Armenian. That is my heritage, Armenian. You are correct. What is your heritage, Lanu?
My guessing from the last name, I think they're Turkish, but I could be 100% wrong.
That's what I'm thinking too. We'll find out.
I will let you know.
Just about halfway done. Well, Luis, at some point we're going to have to get more cervical scopes.
I've been searching.
Nothing? You know what that means.
We need to create one.
Huh?
We need to create one.
We're going to have to make our own. Or we go to Germany and hijack Wolf. Take over. 5 minutes. Did Lanu answer?
I'm still waiting for their answer. Not yet.
Well, if she's Turkish, she may not want to answer.
Possibly.
But that's okay, Lanu. I don't blame you for the massacre of 1.5 million Armenians by Turkish Ottoman Empire. I blame your ancestors. If you're Turkish. We're making some assumptions. I don't normally make assumptions. I make educated guesses. Okay, so this disc is definitely a bit different than the last one. Why? Number one, it's got more scar tissue and it's more collapsed. There's less soft herniation. This is all scar tissue at the back of the disc caused by the herniation. These are pieces of herniation coming out. But that said, things are going well. We're almost done. This is the last of the herniations. I probably have about 3 more and we'll be done. I'm just checking as much. This is all scar tissue. If you want to know what scar tissue looks like, endoscopically, this is it. It's a piece of degenerated cartilage, and you could call it a loose body. I don't want to leave it in the case it causes inflammation and pain. But otherwise, this looks pretty good.
Lanu just answered. They said Taiwan. I have worked with Armenians in the medical lab in the past. Actually, some of them can speak Farsi. Is Iran near Armenia?
No, it's a great question, Lanu. Iran is next to Armenia, but that's not why they speak Farsi. When Armenians were persecuted for their religion, and the Turkish Empire tried to slaughter all the Armenians back in 1915. Armenians left Armenia to get away from being killed, just like Jews left Germany and Austria to try to avoid being murdered by the Nazi Germans. And when they left, they went to countries like Iran, Iraq, Egypt. They left for neighboring countries. 2 minutes. And of course, they're going to learn the language of that country that they went to. My father, for example, his family left Armenia and went to Egypt. So I am actually Egyptian heritage from Alexandria, one of the greatest countries in the world, but Egyptian. So my father learned Arabic. Then he left and went to Lebanon after medical school, and he learned how to speak Lebanese, French, German, and Turkish, and English, and Spanish. So it's not uncommon for Armenians to speak more than one language. I am the anomaly. I speak one language. I'm horrible at languages. Absolutely terrible. My brain cannot learn languages. I mean, I can pick up a few words here or there, but it's very common for Armenians to pick up languages of the countries they fled to. They sought refuge and shelter. All right, we are done. I don't see any more herniation back here. Hopefully it stays that way, and look at that, looks good, very happy. We went from side to side. I think he's going to do really well. A little bit of scar tissue. We can't get all of it. This stuff isn't doing anything, but all the stuff that used to be back here that was causing all the inflammation and scar tissue is gone. Just take one more peek.
We have another question
I'll take one more question.
coming from Teresa on Facebook asking, can cervical discs problems cause migraines?
Yes, they can. Cervical disc problems can cause migraines.
Thank you.
As a matter of fact, the name of that headache is called a cervicogenic headache. Type it up for them, Henry. Cervicogenic, cervicogenic. And it just means that the genesis or origin of the headache is the cervical spine rather than something in your brain. But obviously there are many causes of headaches: brain tumors, infections, meningitis, viruses, migraines, stress, and cervical disc herniations. Cervical disc herniations, in my opinion, account for probably as much as 10% of headaches that people have. And what we found was by doing this surgery on patients with neck pain and headaches that we got rid of the headache, 92% of the headache on average, 92%. That we published that in our paper. If you look up the Deuk laser disc repair paper, you'll see we were able to eliminate 92% of the headache. I think it was 92.5. Okay, here is the incision. Everybody see that? Bring
Yes, we
me
do.
a tape measure. Okay, so 4 millimeters, 2 discs, no fusion, no metal, no bone graft, no hospital, no sleeping over in the hospital. Outpatient. He's going to go back to his hotel or home tonight in about 2 hours. And let me have the stuff. And then he can be back to work tomorrow, shopping, driving, enjoying time with his family.
Before ending, we do have one more question.
Of course.
Coming from the classic Carnut
That's
on YouTube, asking, can sciatic nerve flossing for nerve tension help free up the entrapment?
I'm sorry, yes, it can. Well, I will show you how to do that. Can you see me? Hold this.
1 second.
I'm over here.
Yes.
All right, this is how you do it. Where's the camera? Move the
Right.
camera.
Yeah.
I'm over here.
Perfect. Oh, that is Luis. I apologize.
Oh, from the board. But I'm right behind Luis, Henry. Come on.
Okay, there you go.
You
Okay.
got to play a little more video games. All right, you ready?
Yeah.
Here, the sciatic nerve flossing. No, flossing cannot help sciatic nerve. Flossing is a type of dance move, and I think it would make your sciatic nerve worse. Yeah, scope use is going to be a 7. All right, we'll be back in 30 minutes or so, hopefully, with another surgery. But this one went very well.